Hey there, welcome to Spinal Health TV. I'm Dr. Graham, this is Dr. Scott from East Coast Chiropractic, and we are covering disc herniations in this video. We're going to talk about what is a disc herniation, what is a disc bulge, and what's an interesting fact you may or may not know about this phenomenon. So here we have the spine model, and if we look at these little pads in between the bones, these are called the discs. Now the disc on the inside has a jelly-like substance that would be called the nucleus pulposus, and then around it is a really tough outer ring that's called the annulus fibrosus. Jelly should be in the middle, should not be on the outside. So why is this all important? Well, if you look behind the disc here, in these holes, the spinal cord is running through there and the spinal nerves are exiting. And if you don't know what these guys do, signals go from the brain down the cord, out the nerves to control your body. So we obviously want to make sure that that system is really clear and functioning well. So let's get into it. A disc bulge in particular, what we see happen is some micro tearing that takes place in that outer ring, and then that jelly-like substance can push on it and can almost make it expand. And in some cases, it could be significant enough that it will compress some of these tissues. But the key with the bulge is the jelly is staying inside. If we look at a full-blown disc herniation, that jelly has made its way all the way out and oftentimes is going to project into that canal where all that really important neurological tissue is running. So here's what's very interesting, and this is the fact. Not everybody who has a disc bulge or who has a disc herniation will have symptoms. It doesn't mean you're going to have pain, and it doesn't mean you're going to have some of the nasty things that go along with that problem. But here's the lowdown. If you have that, it's still damage to the spine, and it's still an indicator that there's problems there that need to be addressed. So in any case, hope that's a good start for you, and stay tuned for next week because we're going to talk about the most common signs and the most common symptoms that go along with a symptomatic or an active disc herniation. So hope that's helpful for you. We'll talk soon.